Hi, we're Team 2, and this is our analysis activity. The team is conformed by Eloína Net Álvarez Alarcón, Sofía Martínez Garza, Leslie Yesenia Mercado Rocha, Jeroni Saray Rodríguez Favela, Arnoldo Sierra Cantú, y en mí, Victoria Pedraza. Well, first we're going to present the keywords. The first one is muscle. This is a tissue of the body which primarily functions as a source of power. There are three types of muscle in the body: skeletal muscle, cardiac muscle, and smooth muscle. The next keyword is movement. That is a stage of changing the position from rest to motion or vice versa. Movement can be both voluntary and involuntary. Movements helps an organism to perform necessary functions. Now striated, highly organized tissues that convert chemical energy to physical work. They generate force and contract in order to support respiration, locomotion, and posture, and to pump blood throughout the body. Now, the skeletal. Striated muscles attached to bones by tendons, which produce all the movements of body parts in relation to each other. Skeletal muscle is under voluntary control. Smooth, an involuntary non-striated type of muscle capable of low rhythmic involuntary contractions. A great part of internal organs and the majority of the area of the digestive tract is lined with smooth muscles. Sarcomere, the basic contractile unit of muscle fiber. Each sarcomere is composed of two main protein filaments, actin and myosin, which are the active structures responsible for muscular contraction. Connective tissue. Tissue that supports, protects, and gives structure to other tissues and organs in the body. It is made up of cells, fibers, and a hair-like substance. Rhabdomyocytes. Large single cells, either cylindrical or prismatic in shape, which form the basic unit of muscle tissue. They consist of a soft contractile substance enclosed in a tubular sheath. And the last one is tendons, tissue that attach a muscle to other body parts, usually bones. Tendons are the connective tissue that transmit the mechanical force of muscle contraction to the bone. Now my partner Arnoldo is going to present his subject.
The basic form of this system are the muscle cells. Their contractile capacity characterizes the muscle cells. This feature is possible thanks to the cytoskeleton. While this structure is present in all the cells and they cannot contract themselves, muscle cells are more efficient and powerful to do so. According to the way in which they organize their contractile apparatus, muscle cells are classified into two types. The striated owes its name to the pattern of transversal striation that its cells show. This banding pattern is due to the organization in sarcomeres of its contractile apparatus. The striated cells are divided in skeletal and cardiac. And the other type are the smooth. In the case of smooth muscles, the organization of the contractile apparatus is different, so bands are absent. As we can see in this table, in the images, the bands are absent in the smooth, while in the striated muscles, the skeletal and the cardiac, the bands are present, are visible, and with the next characteristics, morphological and functional classification. And the skeletal striated muscle. Skeletal striated muscle fibers or rhabdomyocytes are elongated and multinucleated cells of cylindrical morphology with a pattern of transverse strain. The cytoplasm of each skeletal striated muscle cell contains the contractile apparatus constituted by the myofibrils, which are the thin filaments of actin, and the thick filaments of myosin. Both form the sarcomere, that is the functional unit of the striated muscle. Sarcomere, these are limited by C lines or discs. These thin and thick filaments anchor to the C disc. These form the A band and the thin ones, the I band. Each muscle cell has millions of sarcomeres. This pattern is repeated throughout the muscle cell and gives to the cell its striated appearance. Thank you.
Now we're going to see the components of the sarcomere. We have thin filaments of actin and other proteins, thick filaments of myosin, and C discs or lines. The contraction relaxation cycle in a skeletal muscle cell. First, the cells respond to the nervous stimulus, which favors the release of calcium in the smooth endoplasmic reticulum. Then the myosin sticks to the actin, and this one moves over the myosin, shortening the sarcomere. Next, the relaxation phase requires ATP, which is adenosine triphosphate energy, which divides into adenosine diphosphate, ADP, and PI, allowing the thin filaments to slide back to their original position. Now, the connective tissue sheaths. We have two main factors that explain the association of the connective tissue with the muscle. The first one is that the vascular elements arrive at the muscle through this tissue and open the capillary networks that nourish the rhabdomyocytes. These sheaths covering the muscles extend beyond the tendons and disconnect with the periosteum covering the bone. Without connective tissue, there will be no functional association with the rest of the components of the locomotor system. The connective tissue sheaths are three. From the innermost to the outermost, they are endomysium, perimysium, and epimysium. Other structures needed for the muscular system to work are the tendons that connect the muscles with the bones, the ligaments that bind the bones to each one, and each muscle mass has its fascicles and differentiates from the rest of what surrounds it by the epimysium. If the muscle mass shortens, the tendon also moves and inserts into the periosteum that covers the bone, and by that association, the bone also moves.
Okay, now we're going to see the functional muscle groups. To perform different movements, muscles work in groups to control the movements of the joints. These movements are classified in agonist or main muscle. This movement produces most of the force during the muscle action. Synergist, it helps the main muscle to achieve more power. Antagonist, this movement opposes the main muscle. Sometimes the muscle relaxes for the main muscle takes control. Fixer, it prevents a bone from moving to allow the movement of something else. Function of the muscular system. Their predominant function is contractility. Muscles attached to bones or internal organs and blood vessels are responsible of the movement. Nearly of the movement in the body is a result of the muscle contraction. The muscles account for 40% of the person's weight, with the largest muscle in the body being gluteus maximus in the buttocks. The muscle system contains more than 600 muscles that work together to enable the full functioning of the body. The muscular system main function is to allow the movement. When the muscles contract, they contribute to the gross and fine movement. Gross movement refers to large coordinated motions and includes walking, running, and swimming. Fine movements involve smaller movements such as griding, speaking, and the facial expressions. The smaller skeletal muscles are usually responsible for this type of action. Most muscle movement of the body is under conscious control. However, some movements are reflexive, such as withdrawing a hand from the source of the heat. Muscle tendons stretch over the joints and contribute joint stability. Muscle tendons in the knee joint and the shoulder joint are crucial in stabilization.
Now, talking about some diseases, well, first, a muscle disease is any disease that affects the human muscle system, and they're divided into primary muscle diseases result from abnormalities of the muscle themselves, and secondary muscle diseases are caused by another condition that may have triggered or caused the muscle disease. Both types of diseases affect the muscles and sometimes the nerves that supply them. Because of this, both may eventually result in muscle wasting or loss of muscle mass. This may involve loss of strength and function in one or more muscles. Sometimes paralysis may occur. Now, primary muscle diseases. Primary muscle diseases are caused by abnormalities of the muscles. A muscle disease is considered primary if it occurs on its own, not because of any other associated diseases. Some conditions can occur as primary diseases or as secondary diseases. We have polymyositis, and myositis is an inflammation of muscles and their associated tissues, including blood vessels. Polymyositis is a rare type of myositis. It is mostly seen in people over age of 20 and more often women. PM is marked by muscle inflammation and weakness. A person with this condition may experience falls and problems getting up from falls. Other symptoms include chronic dry cough and/or difficulty swallowing. Polymyositis has no known cause and there is no cure for the condition. Fortunately, the condition is treatable. Now, dermatomyositis. This is a rare inflammatory muscle disease and it can affect people of any age or sex, but again is more often seen in women. Now, some common symptoms include a distinctive rash, muscle weakness, and inflamed, painful muscles. Like other inflammatory myopathies, the cause is unknown. There's no cure, but the condition can be managed with medications and other therapies.
Next, we will talk about muscular dystrophy, abbreviated as MD, which is a group of inherited myopathies, and these conditions all cause muscle loss and weakness. Some types of MD appear in infancy or childhood, while others may not appear until middle age or even later. Symptoms are specific to the type of MD, since they can vary based on the muscle groups and people they affect. All forms of MD grow worse with time, and most people even lose their ability to walk. There is no cure for MD, but symptoms can be treated, and treatment can also prevent complications. Some treatments include medications, physical therapy, speech therapy, orthopedic devices like canes or walkers, and surgery. Some people with MD have mild symptoms that progress slowly, and others have symptoms that are severe and disabling. Another disease is rhabdomyolysis, which is a disease that causes a breakdown of skeletal muscles. This breakdown causes myoglobin release in the bloodstream, which is a protein that stores oxygen in the muscles, and too much of it in the blood can lead to kidney damage. Causes of rhabdomyolysis include trauma, infection, inflammation, medications, toxins, genetic and metabolic disorders, and treatment depends on the severity of symptoms and the presence of complications. Kidney damage from rhabdomyolysis may not be reversible. The last disease that we're going to talk about is sarcopenia, which is also called geriatric muscle disease, and it is common in older adults. Other types of muscle diseases are a lot less common in older adults. And well, sarcopenia risk in older adults ages 65 to 70 is around 14%, and this risk increases in those over age 80, reaching 53%. Sarcopenia causes loss of muscle mass and strength, and risk factors include poor nutrition, chronic disease, and reduced hormone levels. For some people, muscle weakness appears suddenly, while for others, it comes on slowly over many years. Physical therapy and improved diet and medications can improve the condition. Going back to the topic of secondary muscle diseases, these muscle diseases appear as a result of other more serious health conditions, as we already mentioned, and they may appear with many different diseases, including infectious diseases, endocrine disorders or diseases of the glands, metabolic disorders such as diabetes, immunological disorders like HIV/AIDS, and vascular diseases, which are conditions of the blood vessels. Primary muscle diseases can also be secondary to another health condition, and these include rhabdomyolysis, myopathy, myositis, myasthenia gravis, and sarcopenia. Here are some of our references in case you wish to investigate further. And thank you very much for your attention. This was Team 2 with the muscular system.